People infected with HIV and dying from AIDS have been in rural areas of the United States for over 30 years now. Despite the incredible advancements made in HIV infection prevention, diagnosis, and treatment, significant health disparities still exist for persons living with HIV in rural areas of the United States. People living with HIV infection or at risk of HIV infection in rural areas of the United States and its territories are significantly less likely to get tested and diagnosed early, to be retained in HIV health care, and to be virally suppressed. This puts them at greater risk of transmitting HIV to others, of getting sick, and dying. Of the multiple barriers to accessing healthcare services in rural areas, the most difficult to deal with has been HIV-related stigma. The following stories exemplify how perceived stigma by healthcare providers and healthcare teams affect the health outcomes of persons living with HIV in diverse rural America and its territories.
Well, fear is a very big concern for a lot of our patients living with HIV. Just as an example, one of our patients I recently did a home visit with, and she was telling me that in all this time she's never once told anybody in her community that she's positive, and none of her families know. So isolation is a huge barrier for someone living in rural communities, and being able to actually have someone that understands what they feel like. And not only that, but to be able to share the day-to-day experiences of someone living with HIV. People are afraid to go get tested, because what happens when they get tested, someone in that community is going to know that they're HIV positive.
I was tested positive in '95. I was diagnosed with AIDS, I think it was maybe in about '06, '07. I mean, my T cell count went to that level. If you don't know what's going on and you're just sick, it's really dangerous to be in the rural areas, because too many physicians in the rural areas don't know anything about it. I met people who had horrible experiences living out here and not knowing, and people with real fear of anybody knowing that they were HIV positive. When I see people who cringe if you mention their case manager by first name in public, like anybody could possibly make the association. So it's sad. What you think of me has nothing to do with me.
Going to the pharmacy, for instance, is a big barrier for people living with HIV in rural areas, and people in our community knowing. That's why so many of our folks will get their medications filled at either a mail order pharmacy or somewhere out of their region, so that no one there knows what their status is. And that's why so many of them don't even go to a private care provider there.
I think we have about 2 to 3 pharmacies that carry antiretrovirals on the shelf. So if this is where everyone is going to pick up their medication, what are the chances that someone at the pharmacy, someone who works in the supermarket where the pharmacy is located, is going to see you picking up a medication and ask why you're there, or maybe make you feel a little bit in jeopardy of having disclosed that status? Some things that you will see in the rural areas include a community health center or another clinic that has not been designated specifically for HIV care. You do see those in the urban areas, clinics that are designated Ryan White, or they're only seeing HIV positive individuals. If the same type of model in a rural area would really put someone's HIV status at risk for disclosure.
When I got pregnant, my doctor strongly advised me to get an abortion, because his advice was to not want to get my baby anything, give them any sickness. And I left the hospital, talked to somebody who was better informed, completely put my mind at ease in the fact that now they have new medical advances, that chances of passing it on to your baby is very, very low. Reassured me over and over. So we decided to have the baby. Worried the whole time about what the doctor had said. Turned out our baby was very healthy baby girl, and healthy to this day. I look at her every day and think about what my doctor told me and thought if I just went with that, I wouldn't have her in our lives.
Education of primary providers in rural communities, there's still some restrictive practices in a way of who's screened and why do we screen. And so I think that, broader education for the general public, but also for providers in rural areas, they're less willing to come to primary care to get tested because of the lack of anonymity, even though there's confidentiality. In a rural area, in small towns, staff members know the neighbors, they're related, the cousin. If someone states that's their reason for coming, then that's immediately part of, the practice's knowledge, the person wanting to be screened. Participating in the AETC HIV Learning Network twice a month. And as a primary care provider in a rural area doing HIV primary care, it has been incredibly helpful. Feel less isolated in how I'm treating my patients and keeping abreast of information and new medications, and all of that. That makes you feel less isolated as a provider, but I think it would help the patients as well.
I was getting care through my provider. Dealing with her, she got to telling me that because I was upset and in tears, and she had told me she can't really figure out why I'm crying because I got myself into this mess and I should be able to handle it. It was my own fault, and maybe if I would have thought about what I was doing, then I wouldn't be having to deal with it, being HIV positive. So I left there kind of feeling like my provider had a preconceived notion of who I was and what assumed I was. I have no idea. It made me feel like I was a junkie or something, but she ended up telling me to go find somebody else to take over my care. So that was the last I've talked to that doctor. Now I don't have a doctor. What I would like to see is more education so that things like this don't happen. Not only just we wouldn't have our babies, we wouldn't have the life that we have now. Everything's different because of that one provider that gave us hope.
In my rural area, I've been to the hospital there, and the second they find out that you have HIV, they're like, well, they really don't want to mess with you. Then when they hear about HIV, it's like there's still a lot of prejudice in the world, and he's African American. He has HIV. Oh, he's gay. 3 strikes against him, he's out the door. Here we are, 21st century. We should be done with that, and we're not.
The health outcomes for people living with HIV, I think, are really affected by stigma because they tend to seek care much later in their disease. Maybe not even get tested until much, much later in their disease, until they're extremely ill, which is what we tend to see in our rural communities as that people are older, until we get to a point where people feel like they can be free to go and see a doctor and not have that fear of being found out or disclosure. Then we're going to have some of those same issues all along. Addressing the issue of stigma in rural communities for those people living with HIV is such a huge issue. If we don't get rid of the fear, not only of the person that is HIV positive, but educate those that are in the community that are living around those that are HIV positive, and get the knowledge out that transmission doesn't happen easily, that you don't have to be afraid of anybody with HIV, and that it's not a sin issue, it's an issue of disease. And just learning to live with that and understand. I think that until we do that, it's still going to be like it was many years ago when people used to whisper cancer all the time, and that we have to get past that and realize that HIV is just a disease. It's not something that you get because you're bad or sinful. And until we get that to that point, then I think people are still going to be living with a lot of the issues they have for many, many years.
Stop treating it as something different. We should be able to walk into any medical provider and say, this is me. My name is Michael. This is what I have. Can we fix me? Can we keep me healthy?
In 1984, Ryan White was diagnosed with AIDS in a rural community and had to move to a safer rural community shortly thereafter due to stigma and prejudice. Ryan died in 1990, and later that year, the Ryan White Care Comprehensive AIDS Resources Emergency Act was initially authorized. As healthcare providers, we can now treat HIV infection as a chronic illness and not a terminal illness, while also preventing new infections, but only if we provide that care in a safe environment for all patients.